Welcome to Muskegon Rising, a community service project of the Muskegon Rotary Club. Our purpose is to create lasting positive change. We've been doing that here since 1916. So, let's get started.
Welcome to Muskegon Rising podcast. My name is Nicholas Green. I'm one of the hosts. Today I'm joined by a beloved figure here in the healthcare community, Dr. Rem Sprague, whose dedication to healthcare in Muskegon County has impacted many lives. Dr. Rem Sprague, thank you so much for being here today.
Thanks, Nick. Good to be here.
Thank you for taking the time. So, let's ask the simplest question we can. What inspired you to be a doctor?
Wow. Well, I think I'd probably decided about age 12 that this is what I wanted to be. I've always been fascinated by the workings of the human body at the gross level, at the micro level, the chemical level, and medical school. The learning was the most engaging and the most fun of all of my educational experiences. Combine that with the humanistic aspect of medicine, where you get to care for people and make them better. I can't imagine a career that more suited to me than one that combines science and humanism.
Nice. Yeah. They always say bedside manner can be taught in medical school. What's your opinion on that?
Well, I think it can. I think people come to medicine with very different personalities. Some are very outgoing and engaging. Some are a little more shy and reticent. And so I think you have to teach the importance of listening, active listening, connecting, empathy.
Yeah.
You can't be caught up totally in the patient's emotions, but you have to be real.
Yeah.
Say, wow, that must be really hard, or boy, that must have been really tough, or that must really hurt. You have to show that you really understand their feeling, even if you're not in their body, you're not experiencing it. And that's what empathy is, and I think it can be taught, needs to be taught.
Very cool. Yeah, that just a few conversations we've had. I don't know you on that deep of a level yet, but I could tell from the few conversations that we had that you probably didn't have to practice that too much. So that's great stuff. We had coffee a couple weeks ago,
right?
And really enjoyed that. You shared a very inspiring story. Could you kind of share the story how you and your mentor came to be, what transpired during that time, and ended up with you owning your own practice? I thought that was just...
It was quite an adventure.
Yeah. Remarkable.
So as part of my residency in internal medicine, we were primary care based, focused not on research or going into subspecialties, but actually practicing internal medicine. And so each of us was responsible to do research on a community that we might be interested in living in. And having grown up on Lake Michigan in Indiana, Lake Michigan really drew me. And so I picked Muskegon as a place to investigate. And I got some demographic data and sort of assessing the need for physicians. Would there be an opportunity if I decided to practice here? And I got connected to Dave Amos, who was chief of staff at Mercy at the time. So I met Dave for lunch at what used to be the Ramada Inn. And he said, "Are you staying here?" I said, "Yeah." He said, "Well, this place is kind of a dive. Why don't you stay with me?" Because he had a nice house. He was single. Yeah. His mother used to live with him. And so there was like a mother's suite in his house. And so, I stayed with Dave for a couple of weeks. I shadowed him and met some of the other medical staff and learned a lot about the community. And by the end of that time, I said to Dave, I would really like to practice here. He said, "Well, I've enjoyed working with you, and I'd rather have you as a partner than a competitor, so why don't you come work for me?" So that was arranged.
Yeah.
Excuse me. So I was working my last shift in the medicine side of the emergency room at University of Michigan Hospital when my wife called, and she said, "Dave's been killed." Well, the story was that Dave, along with Guy Anessa, a general surgeon, and 2 hospital board members, were on a charter flight, a twin-engine plane out of Muskegon Airport to fly to Farmington Hills to interview a candidate as a new CEO at Mercy Hospital. And unfortunately, the plane lost an engine shortly after takeoff. And as they came back to the airport, it torqued and it flipped and it crashed and burned and everyone was killed. So I had planned to be an employee, to study for my internal medicine boards, to start practice slowly and build up gradually. I never intended to be a solo practitioner. I didn't know anything about managing a practice. And I was thrust into that role because of this tragedy. We'd already bought a house, so we were committed to coming to the community. But Dave he was single, as I said, he had no heirs. And so I was able to take over his practice. And now in those days, people often bought a practice from the existing practitioner, but that situation just didn't apply here. So I relied heavily on Dave's banker and his attorney and his bookkeeper, his accountant, and his staff, his wonderful staff. And I just stepped in, and with their help, it just took off. The physicians in the community were very sympathetic, and they sent me a lot of referrals and consultations and kept me really busy. So instead of kind of a slow start, I hit the ground running, and I've been running ever since.
That's just it's a very sad story, but it's also a very remarkable story on how things came about for you.
Dave was such a great contributor. He actually left practice for 6 months to do a fellowship in nephrology, kidney medicine, so he could help Mercy start doing dialysis. Until they were able to recruit a full-time nephrologist, Dave ran the dialysis center. I mean, he really extended himself. It was a big loss to the community, as well as Guy and Essa and the 2 hospital board members.
Yeah. Well, nephrology and dialysis is probably a big part of this community
as
well.
It is, yeah.
I would say I rode with Pro-Life for a little while when I first lived over here, and a lot of those calls were dialysis, missed appointments, or weren't feeling well, some sort of,
Yeah, it's a life-saving treatment, yeah.
Yeah, so he was a pioneer in that then?
Yes. I mean, he just stepped out of his usual comfort zone and did what needed to be done for the community. It was great.
That's great. I appreciate you sharing that story again. I know that's probably a soft spot for you.
It is, yep. Usually I tell it, I get pretty emotional, but I've told it enough now, and that was 40-some years ago, 43 years ago, so the emotion has subsided a bit, yeah.
Being in Muskegon County as a physician, you've done a lot for the community. ACLS instructor, MS health teacher, middle school health teacher, advisory board, coordinated the primary care network. What inspires you about Muskegon County? I mean, we kind of just heard a little bit there. That was a little forced, but you said you did some research on the demographic and
I did,
chose Muskegon County. So,
well, first of all, it's a lakeside community. The other piece was, and there are a lot of lakeside communities, many of which rely heavily on tourism, and so they have a fluctuating population. I like the size of the community. I grew up in Michigan City, Indiana, similar sized city to Muskegon. And I like the diverse economy. I grew up in a family that had a manufacturing business, so I value manufacturing as a piece of the economy, but also beautiful natural resources. To me, it was just a perfect fit. Fortunately, my wife was flexible enough to agree, although she moved a lot. She grew up in the UP and in Virginia, and then she graduated high school in Florida.
Oh, okay.
So she didn't have a strong geographic anchor. And so she was certainly open to this. We met at the University of Michigan, so we both love the state. And we've watched Muskegon go through its nadir. I mean, it's really a downside when the downtown looked like the remnants of World War III, with piles of rubble and sand and the deconstruction of the downtown mall. But, Muskegon Rising is the statue at the corner of 3rd and Western speaks highly. If you look at Muskegon's legacy back 200 years, it's been a cycle of boom and bust, and they've always found a way to rise again. And with investment by the foundation, by the Chamber of Commerce, by private investors, contractors, home builders, and support from the county and the city, Muskegon is rising again, and we're just so gratified to see it.
Yeah, it's come a long way.
It really has.
I only saw it 2008 to 2010, so obviously you've been here way longer than I was.
Right.
But just to see, rise from the ashes and the rubble and sand, and it's been remarkable. We live downtown now, and just it's how lively it is every night,
great.
And the hockey games, and it just there's a new spirit about it.
Absolutely,
and it's good to see. So, tell us a little bit about Mercy.
Yeah.
When it was established,
sure.
Kind of what happened with that, and then we'll roll into the Trinity Health.
Okay. Yeah.
Piece. So
Mercy was established by the Sisters of Mercy in 1903. They actually sold. It was like insurance. They sold tokens to lumbermen. They went out into the forest and just sold these guys vouchers basically for healthcare, and then they established a hospital. About the same time, Hackley Hospital was established by Charles Hackley. Mercy, the Sisters of Mercy, of course, was a Catholic hospital. Hackley was part of the mission of the First Congregational Church, where Charles Hackley was a member. And so they've been sort of competing ever since then for over 100 years. Muskegon General was founded, I think, in the 1940s by a group of osteopathic physicians who at that time were excluded from medical staff membership at Hackley and Mercy, and so they built their own hospital. And then Heritage Hospital, I'm not sure their history, but so when I came to town, there were 4 hospitals. Over the next 15 years or so, system-based hospitals like Mercy had some significant advantages. So Mercy was founded by the Sisters of Mercy. It was part of a very small system that grew over the next 100 years to be in numerous states and still part of Mercy Health Services. And because it was a system-based hospital and it had geographic diversity, it was able to offset challenges in one state with benefits in another and consolidate those resources, manage treasury, and develop skilled administrative people that small independent hospitals were challenged to do. Hackley saw the wisdom of that. They actually, at one point, were connected with Spectrum for a period of time to try to get those advantages, but found that the pressure to conform was a little too great. They lost too much autonomy. So after that relationship failed, Roger Spoolman, who was then the CEO at Mercy, and Gordon Mudler, the myth, well, sort of myth, I guess. The story is that they were both in D.C. to engage with legislators on some critical issues for hospital reimbursement, and staying at the same hotel. And they went out in the morning to get a cab, and they were standing there. Roger said, "Why don't we share a taxi, and we'll go up to the hill together in a taxi?" And in that taxi, Roger proposed to Gordon that Hackley become part of Mercy Health Services. And so that one thing led to another. And ultimately,
so it's more than a taxi ride.
Yeah, more than a taxi ride, and more than a coincidence, probably. So Hackley became a part. Now, prior to that, about 8 years prior to that, Mercy and Muskegon General had already come together, and that had proved very beneficial to both parties, which I think helped convince Hackley that this was a reasonable thing to do, and that it wouldn't destroy their autonomy or their identity. Merging hospitals, there's always cultural differences. There are a lot of challenges to that, but a lot of benefits come from consolidating into one. In fact, eliminating a lot of unnecessary administrative overhead that was duplicated, a lot of duplication of technology that was not needed by the community. We didn't need multiple places where radiation therapy was provided. We really wanted to consolidate that. The cost reduction resulted in our ability to build a new hospital, the one that's currently at the corner of Sherman and US 31. That would not have been possible if we were still fighting tooth and nail over a shrinking market and not competing effectively with Spectrum and, now Corewell in Grand Rapids.
So you kind of just touched on it, but it's sometimes a sensitive subject in the community with having, one hospital, one main hospital to serve the entire Muskegon County.
I acknowledge that for sure.
Yeah. And there's always, you could drive to Grand Rapids, right? But it's also 50 miles away, an emergency, and et cetera, et cetera.
Right.
So it's great that you're touching on that. We dive a little deeper and kind of maybe provide some insight and outside of the corporate side of it, and maybe ease some minds on why that happened and how it is still effectively serving the community.
Yeah, both the hospitals definitely had strong advocates, devoted patients that would never go anywhere else, and many of them were very unhappy when they heard about the merger, especially once we consolidated all operations in one campus and closed the Hackley campus and basically deconstructed Hackley Hospital.
Right.
That was painful for a lot of people. There was a lot of pride, and justly so. It was a great hospital. They provided great service. The problem is with healthcare evolution, it's become much more focused on finances than it used to be. Reimbursements have been gradually reduced. I know people talk about the rising cost of healthcare, but on a per unit of service, the pricing the reimbursement has not kept up with inflation. So it's been a huge cost pressure on hospitals. Mercy operates with their target operating margin is between 2% and 3%. That's not a huge operating margin. And now post-COVID, the cost of employment has risen dramatically. And that's not just in the healthcare industry. We've seen it across the country. Finding staff who can provide this high-skill services is getting more difficult all the time. So although those pressures come to bear that drive decisions that people feel are purely financially based. But at the same time, Mercy, the now Trinity Health Muskegon, what I colloquially refer to as Mercy Hospital, is dedicated to benefiting the community. The health system spends a lot of time and effort learning about community needs and specifically investing in areas where the community has said we need more service. We need more primary care. We need more access to affordable pharmaceuticals. We need more mental health services. And the health system listens to that. And as a former executive, I was part of the group that paid close attention to the community needs and used now our enhanced resources because of the reduction of excess, wasteful administrative duplication. We've used those resources to promote the community's health, engaging with other community organizations, partnering, and really trying to build a healthier community.
That's great. Great insight. So you touched on mental health for a hot second there. Not that was your primary focus, but what has Muskegon done with those additional resources and funds from consolidating? How has that impacted the mental health? First of all, we've maintained an inpatient psychiatric hospital. If you look at West Michigan, approximately half of the inpatient psychiatric hospitals closed over the last 10 years. There's not many left.
No.
Yeah.
And reimbursement was a big problem. Staffing was another issue. So we have maintained our commitment to, my past personnel, we have maintained a commitment to inpatient psychiatric services. Mercy did stop providing outpatient psychiatric services, but Pine Rest has filled that void, invited into town by Mercy, actually, to enhance outpatient services. And Mercy collaborates with Health West, looking at appropriateness of hospitalizations, working at helping people who present to the ER with acute substance use issues or acute psychiatric issues, and finding appropriate placement for these folks. But it's still challenging. There's not enough psychiatric beds in the state. We still domicile people in the emergency room for extended periods, trying to find placement. Trinity Health West Michigan is collaborating with another outside partner to build a new psychiatric hospital between Muskegon and Grand Rapids that will also help meet the need.
That would be huge.
Yeah.
Yeah. There's Pine Rest. There's another one down in Kalamazoo. I can't think of the name off the top of my head. But yeah, there's not many resources out there for that, especially post-COVID. There's probably been a drastic increase,
huge increase in demand
for it. So it's reassuring to hear, and hopefully that comes to fruition soon.
Right.
So, how can the community help improve the health and well-being of the neighborhoods that we live in?
That's a really good question. People look at health status as kind of an indicator of the health of a community, and we know that Muskegon ranks near the bottom of counties in Michigan. And yet our neighboring county, Ottawa County, is near the top in terms of health status. So a lot of the difference is socioeconomic. It's people who, it's educational attainment, it's well-paying jobs, it's good benefits, it's safe living environments, it's access to quality food. When you look at the determinants of health, medical care is about 15%. Yeah, genetics probably around 10%, environment, health behaviors, 60%, 70%. So we're working with other community agencies to promote a healthier community. That means safe neighborhoods. It means affordable housing. It means affordable health care, things like Access Health and insurance companies that are affordable. It means good educational attainment. high-paying jobs with good benefits, and it means access to good food in every neighborhood so we don't have food deserts. A healthy outdoor environment for people to be physically active. All of those things are necessary to achieve better health.
It's a holistic approach.
It
right?
has to be, yeah.
Yeah. So you mentioned health status,
Yeah.
Ottawa County being at the top. Can you define that a little bit?
Well, yeah, it's a measure of the percentage of obesity, the percentage of hypertension, percentage of diabetes, life expectancy, lifespan. All of those kinds of things go into the calculation of health status.
Okay. So being at the top is not the good thing.
Oh, no. Being at the top is a good thing. Yeah.
Okay. Being at the top. Okay.
Being first
I didn't know
or
if there was
second.
an inverse.
No. No.
Correlation
Being at the
there.
top is a good thing. Ottawa
Okay.
County is near the top.
Ottawa County's near
Yeah.
the top. Where's Muskegon County fall?
We're
in
near
that?
the bottom.
Okay.
So actually, Rotary had an initiative called 1 in 21, hoping to be the healthiest county by 2021, which was definitely aspirational. It wasn't a realistic goal, but it drove Rotary to consider how can we connect with and partner with other agencies to promote greater health in this area.
What are some organizations that do help cater to that focus?
Mental health is a big piece, so Health
Right.
West is a part of that. Schools taking a broader approach to engaging their student body, providing additional services other than just educational, because that's a place where they spend a third of their waking hours, and so they're sort of a locked-in audience, and providing services in the schools. Access Health is a program that provides health coverage for low-income employees. That's important. United Way does a lot around healthy children, daycare programs with a 3-share daycare program to enable people to work and still have good care for their children at home. The health department is really critical in promoting health through immunizations and education and helping with things like smoking cessation. Substance use treatment is another part of a significant condition in Muskegon County, and we have providers of services for substance use as well. It really has to be a broad collection of approaches. Places like Mission Prairie People that provide access to healthy food, places that deal with the homeless situation, and even the city and the county are investing in infilling affordable housing, another key piece of safe communities, safe neighborhoods, and healthy communities.
Yeah, we've spoke before in past interview about the affordable housing being an initiative for Muskegon County.
Really important.
And heading in that direction. And then recently in Rotary, we had the gentleman come in and fantastic presentation, but really opened eyes to a lot of things. And, thinking back on healthcare and how much everything you just spoke about, resources in the community, affordable housing, the schools partaking in healthier lunches, things like that, all help shape the health of our communities.
Right.
And tackling that at a large scale is quite difficult when you don't have the buy-in from everybody. Right. Not necessarily everybody, but those who do care, how do you get it out to let them know that there are things that you can be involved with? Yeah,
and it has to be a non-judgmental approach. People come at this with all sorts of life experiences that influence their behaviors and their capabilities. And so we need to recognize that and just work with people where they are and make small incremental changes. And over time, it won't be by 2021, obviously, but over time it will come about.
Yeah. Small steps towards a greater goal.
Well, my final statement is Ginny and I love Muskegon. We chose this place. We're so happy that we did. And even though we've seen it go through significant struggles, we're so pleased with the progress it's making. And I would highly recommend this place to anybody.
Awesome. Dr. Sprague, thank you so much for taking the time this morning, providing immeasurable insight to Muskegon County and what's happening with Trinity Health and all the resources that you're trying to bring forth and all your active boards that you're on. How many boards are you on currently?
I have lost count.
He has lost count. He's on a lot of them, but he is shaping the community and steering it in the proper direction as far as the healthcare in the community and improving our lives here in the community. So thank you so much.